To revise and extend my remarks.
Without objection.
Mr. Speaker, it is deeply disappointing that following last week's near universal calls for unity and cooperation, amidst all the calls to lower the temperature of political discourse and to move to working together towards solving America's pressing issues, the new Republican majority is moving full steam ahead with an attempt to repeal the Affordable Care Act. The health care law may not be perfect. That prospect would always certainly be open to debate. And its suggestions on how it might be improved might also be open to debate. But instead of working together and building on the work that's been done and the progress that's been made, we find ourselves here today debating and voting on a bill which, while it may pass the House, most certainly will never become law, and nor should it. Some may call it political catharsis, others may call it pure theater, plain and simple, but let's be clear. The positive impact that the existing health care reform law is having on millions of residents and families in all of our districts is very real, and the law's important common-sense consumer protections are very popular. Specifically, this misguided legislation would spell the end of one meaningful consumer protection, which I and others fought to get into the law. This protection, the medical loss ratio requirement, holds insurance companies accountable and ensures consumers are receiving the health services for which they are paying top dollar. In 1993, many private companies routinely spent 95 cents of every dollar on health services. By 2008, in the absence of regulation otherwise, many had reduced their spending on health services to below 75%, some even to less than 60% of those premium dollars. That meant that companies could spend up to 43 cents of your premium dollar on executive salaries, advertising, lobbyists, bonuses, dividends, and other administrative costs, instead of using it for what you had contracted for, health care. To keep their excessive profits up, you may have been charged ever higher premiums or may have been denied care through a number of anti-consumer gimmicks. You might have been denied coverage because you or your family member had a pre-existing condition, or you had coverage capped annually or in a lifetime, stopping coverage when it was most needed. Or as a parent, you were refused coverage for your children under 26, even if they were still unemployed and were working someplace where coverage wasn't available.
Expired. Gentleman from Minnesota.
All of these injustices are addressed in the bill, and repeal would reverse that.
Gentleman's
I ask
time's
that this
expired.
misguided bill fail and ask my colleagues to vote against it.
Gentleman's time's expired.